Yeast infection facts regarding treatments. How a specific yeast infection should be treated depends on many contingencies that can have an effect on the best treatment to follow. Your doctor may know of a much better treatment that you're not familiar with that might be more suitable due to one of the variable factors present. Obviously, the only person who can competently make that final call is a medical doctor. Still in all, if you go searching at the pharmacy for an OTC medication for candidiasis, you won't be disappointed. There are many to choose from. However, please keep in mind that it's been reported that only 1 in 3 women from a recent study who self-diagnosed their yeast infection did so accurately. It's astonishing that so many women were wrong with their diagnosis. If you want an accurate diagnosis and treatment plan, you must be examined by your doctor and let him or her determine exactly which vaginal infection you have. Even your best shot guess could be wrong in spite of the fact that you have had similar symptoms before. Actually, there are 3 infections called vaginitis, and only a yeast infection is caused by the Candida albicans fungus. The others are caused by sexual transmission of a protozoan or by bacteria. If you self-treat, you take the risk of treating for the wrong infection and could worsen your condition. If that should happen, then you will be paying a visit to the doctor anyway. The ratio of correct diagnoses, according to one study, is only 1 out of 3. The rest of the women who self-diagnosed were incorrect as to their type of infection. There are other conditions that produce similar symptoms, and even secondary conditions, such as vaginosis or vulvitis. In the case of bacterial vaginosis, the infection can be caused by an assortment of bacteria. There is a particular type of protozoan that can cause symptoms very similar to vaginal yeast infection. Protozoa are unicellular protists similar to amoeba, but are considered animals. In the event your infection is sexually transmitted, but not a yeast infection, treating it with over-the-counter yeast infection remedies won't do any good. If you or your child has had a yeast infection, you most likely treated it correctly at the time. However, if the infection returns, there are preventative steps that you can follow this time so it doesn't return in the future. If, for example, any item that came into contact with your child's mouth while he or she had oral thrush must be sterilized and washed. It is also recommended, as well, that mothers who are breastfeeding be checked for a yeast infection around the breast. The ideal course is to speak with your doctor about the overall situation to receive comprehensive and accurate information. Yeast infection treatment is usually quite successful even if the condition was not immediately addressed and has become worse. There are many different symptoms that can manifest when you develop a yeast infection. They will depend, in part, on the location of the yeast infection and other factors also. One good thing is that as the symptoms get progressively more unpleasant, most people will hasten to get treatment. For the most part, a Candida albicans yeast infection will respond quickly and successfully to treatment, but there are many more elements to a yeast infection than just vaginitis, so any indication of candidiasis must be taken seriously. A yeast infection in your gastrointestinal tract is not something to take lightly, and you must see your doctor immediately to begin treatment before it gets more out of control.